All right, so for the first question, what has been the biggest challenge in the changing status of the Affordable Care Act? So for me personally, I just got kicked off my dad's plan as I turned 26, and I switched over to Medi-Cal. And, after reading this week's material and listening to the videos, I'm actually very afraid for, the future of my medical insurance status. And I just feel like a little bit uneasy because just the cost of my medicine that I have to take every day would be just unaffordable for me. So that's a little bit scary to think about. Another thing for me is that Portland State requires that you have health insurance, regardless if you're out of state or not. So I would actually, if I did lose my Medi-Cal insurance, I would have to pay close to $900 out of pocket for insurance that I wouldn't even be able to use, which is ridiculous. Lastly, for the last video that we watched this week, she mentioned that there's been a lack of, they took funding allocated to advertising for like Medicare insurance, and I have significantly noticed that, thinking of that, for example, when I went to go sign up for Medi-Cal insurance at the Human Services Agency over here, I had to wait all day to just turn in my paperwork, and it just shows like that they're really defunding a lot of areas for marketing, Medi-Cal and Medicare for people that really need it. So it's making it so people might not even know it's available. So question 2. Slide 14 refers to the limitations in evidence-based care. It suggests that the use of research data and metrics to inform treatment does not always translate to person-centered care. Can you think of a time this felt true in your direct practice? What did that look like? Unfortunately, I have come across this bias on several occasions in a healthcare setting. One thing, that's mentioned in our readings is that a majority of research studies require significant amounts of money, so oftentimes these research studies are geared towards making the rich richer. As it's stated in slide 7, American policies are dominated by the rich, and this includes like the topic of medical research studies, who are funding these research studies being the rich. So oftentimes, potential side effects of pharmaceuticals, for example, may be glazed over or, gone through really quickly. Like if you ever see those commercials, which, side note, America is one of the only countries that will allow commercials to even advertise on the TV for pharmaceuticals. And so when these, side effects of these drugs are glazed over, people who are affected by those side effects, it could be even deadly for them. And really the only people benefiting primarily would be the rich in these examples, because these studies are they're created for targeting clients, and oftentimes like these, for example, side effects of the drugs are just not really mentioned or just barely glazed over, which can be consequently deadly. Question 3. Referring to the power in a political narrative reading, can you identify 3 distinct political narratives that came up in the Julie Royner on the Future of Healthcare video? So at 28:45 in the video, Julie talked about how they took off the penalty tax for not having Medi-Cal insurance, and initially that was created by politicians for the purpose of helping increase the rates of sign-up. But they found out that the tax made no difference, as there was the same amount of people signing up as the previous year despite the penalty. So my question with that would be, did the penalty help? I mean, obviously they're saying it didn't, so who was behind this who was behind creating this penalty tax, and where was the money allocated for those penalties, as that money could have been dispersed into the funding for Medi-Cal users. And then I also have stopping at 33 minutes in, the issue, when she mentioned the issue of people trying to purchase cheaper prescription drugs in Canada, because the costs of, drugs here in America, the same drugs are so much more expensive. But the drug companies are threatening that if they were forced to reduce the cost of prescriptions in America, where they get a bulk of their money, they would go bankrupt. So Americans without the ability to afford their life-saving drugs are, in contrast, also going bankrupt trying to purchase their medicine. However, in other countries, these drug companies are still selling these drugs at reduced costs, which they would definitely be, in my opinion, be able to afford to most likely reduce the costs of medications here in the States. And the last I have for that video, stopping at 4128, people feel like they're paying more but getting less, and in contrast, doctors feel as if they're not being paid for their services, for the amount of time and energy they put into going to pursue a higher education to become a doctor. And so, this is definitely a huge contrast. People feel like they're paying too much for healthcare. Doctors feel like they're not getting paid enough. But a huge middleman in this is the medical insurance companies, who are not paying the doctors enough and charging our patients too much. So that is something that definitely needs to be looked into, like reducing the cost of health insurance. And then the last question number 4, refer to your readings on recent veterans' health policy changes. What kind of rationing, slide 11, is occurring, and what societal values from week 8 are playing out? So after reading from week 2, slide 8 are playing out. After reading the veterans' health policy article, I have to point out that patients are definitely the ones incurring the brunt of the lack of services available to them, and, for example, veterans who are severely in need of mental health services and just not being able to access that. So that would be on a micro allocation, so for on the individual level for patients, and then it just makes it hard for them to be able to have access to anything, and it's just, in the long run, costing America more, as it was stated in our slides for this week, that by not having universal health care, it is costing us more in the long run. So that's something that we do need to take into account as we move forward.